One of the other things in his shoulder that he was having is thoracic outlet syndrome. So the patient had some paresthesias along the ulnar nerve, or basically the fourth and the fifth digit along the inside of the arm, that would get worse in the morning, so after sleep, and then would usually progressively get better throughout the day, and would sometimes aggravate with heavy workouts for the chest shoulder region. So our physical exam on that one showed that we did not have any entrapment of the medial antebrachial cutaneous nerve and the forearm. We didn't have any entrapment of the ulnar nerve at the cubital tunnel. What we actually had was an entrapment of the medial cord of the brachial plexus underneath pec minor. So our testing for thoracic outlet showed that there was no impingement in the interscalene area, so between anterior and middle scalene, but we did have underneath pec minor, we had some compression, and because of the distribution that he's getting, we can assume and we know that it is the medial cord. So what we did here was, again, all this done under ultrasound guidance. We advanced the needle underneath the pec minor muscle to do a fascial hydrodissection of the fascia that contains the brachial plexus and the pec minor. We also additionally went inside the fascia that's containing the brachial plexus and the axillary artery and hydrodissected in there in order to give some support for the healing of a brachial, or the medial cord of the brachial plexus, that is going to be a little bit inflamed, because we know that because we're getting some symptoms. So our goal there is a type of non-surgical decompression where we're actually creating temporary space. The fluid that we inject in will get absorbed over time, but we provide some temporary space, which helps the nerve to heal because there's less compression on the nerve. When there's less compression on the nerve inflammation tends to go down. And we also included the nutritive substances, so our platelet-poor plasma, which is going to be really rich in growth factors. We have the 5% dextrose, which helps to calm down some of that neurogenic inflammation, and then some low-dose ropivacaine and dexamethasone, again, further to help calm down that inflammation. And so we are essentially just trying to get all that inflammation to calm down, doing that through a hydrodissection approach.